All right, so we have the Hare traction splint. We're going to demonstrate the proper way to put on a Hare traction for a broken femur. Good tool to use, but sometimes it doesn't get used as much as it should. Contraindications to using the Hare traction splint is if a bone is penetrating through the skin. You don't want to pull traction on the leg and suck the bone back down through the skin. So I'm not going to use it then. I'm just going to support the leg the best I can and wrap and treat the wound from there. Another reason why I'm not going to use the Hare traction is if I have a hip fracture, because it'll pull pressure on the hip, causing more pain for the patient. It's hard to differentiate a high femur break and a hip fracture. Maybe that's another reason why it doesn't get used as much as it should, is because we truly don't know really high femur to hip. Unless it's a late sign, usually you break the femur, you have a lot of swelling of that femur, and it's going to cause blood and fluid inside the space, and it's going to be double the size of your other femur. So that's a dead giveaway. Other than that, we're just not sure. We took a patient into the hospital a few weeks ago. We thought with a hip injury. We did the sheet method, splinted the hip the best we could, gave the patient some relief. But we took the patient into the hospital. A couple hours later, the doctor told us that the patient had a severe femur fracture, because it was just hard to tell, hip from femur. The doctor did tell us a good sign or a good indicator if it is a hip fracture, the foot will be angulated on the inside. If it's a femur fracture, the foot will be angulated on the outside. So that would be a good indicator if you didn't have the swelling to kind of tell you for sure which bone was broke. But one thing for sure, if you go on the hip fracture or a femur fracture, the leg is going to be shortened. So you'll have a good leg discrepancy in length, no matter which one that you're responding on. So that's where the Hare traction is going to come in for a femur. We're going to say that Talmage's right femur is broken. Usually the femur fractures I have been on, the patient's going to be presenting in a position of comfort, usually with their leg in a bent position like this. We're going to need to pull traction on this femur while we're setting up the Hare traction. So usually we'll have my partner would come towards the patient here, and we want to relieve the pressure off of this femur. And you can do that easily by pushing up on the knee and pulling down on the ankle and relieving that pressure and just kind of leaning back in to yourself and having your body weight just pull a little bit of traction on this leg like this. I would try to limit pulling the leg straight like this right out of the gate. That is just too painful. But you can go ahead and push pressure up underneath the knee and the ankle at the same time and just hold traction on that while we're setting this up. So my partner is going to go ahead and hold traction on that leg while I set up the Hare traction splint. And while what we do here is I need to measure the good leg, because remember the broken leg is shortened. So I'm going to put the blue pad, it goes high up underneath the butt to the ischial tuberosity, high up in place. The Hare traction has these little rubber stoppers here, so I can extend this out into the length that I need to make it. So when I end up pulling traction, for my end result, I have the right length. When I'm measuring the Hare traction, I want to go 8 to 10 inches past the good leg. So when I do pull traction on the bad leg, that I'm meeting my objective by pulling traction. I can then go ahead and tighten my stops so the hair traction does not move. I now bring this over to the injured side. My partner's still holding traction. I'm going to undo the straps on my hair traction because it makes it a lot easier when it is placed up underneath my patient. I'm also going to undo the crotch strap. Up underneath your patient, okay, high up underneath. My partner is still holding traction. The first strap that you want to do up is this crotch strap. You want this high up into the groin as possible because this secures the hair traction into place. From here, we have this ankle strap. This goes underneath the ankle. Putting this into place, go ahead and do up the strap. You want this strap located on the heel portion of your patient because when I pull traction, I'm going to pull traction on the bottom portion of the heel. I never want this buckle on the upper portion and pull traction down. It's going to be too painful for my patient. So this needs to be located on the bottom portion of their heel. We have the ratchet strap. This is what's going to pull traction on my patient's leg. This slides into a buckle up underneath the heel. Now, still remember, my patient has this in a position of comfort, holding traction in the upper position. And then this is where we lower the patient's leg down together. I start ratcheting and pulling traction on my patient's leg. Your patient will let you know when they feel relief. That's why when we measure the good leg, I go 8 to 10 inches past. That way I have plenty of room to make sure I'm pulling traction. It'd be horrible to run out of space before my patient's pain relief is gone. So I'm pulling traction.
That feels much better.
Your patient feels relief. So from there, I'm going to stop traction. I come back. My straps are already undone. The straps should tell you where they go. If not, the very top strap says upper, to the rubber bumpers or the rubber stops or the very top portion of the femur. The second strap is just above the knee. The third strap is just below the knee. And the fourth strap is just above the ankle. So that secures your patient's femur to the hair traction. Now from here, we lower our patient up either via backboard or scoop stretcher, load them on the gurney, get them in the back of the ambulance. But make note, notice how far this is sticking out past the patient's leg. It could stick out that far past the gurney. So when you load the patient up in the back of the ambulance, be mindful of the door before you close the door so the door does not hit the bottom of the hair traction. If it does, sometimes we need to flip the patient around inside the ambulance so their legs remains in the traction and the door doesn't hit the bottom of the device. If there's any questions, contact Rachel, 911.